I think it's probably, we got seats here, but it's probably just as well from a COVID perspective if you're standing out in the open air. Thank you for joining us today for this American Rescue Plan announcement. It's good to be here at this beautiful location, Secretary McGarrick, with your team. Thanks for hosting us. It's great to be here with my friend Senator Ennis and Representative Carson and our Lieutenant Governor. Thanks for being with us, our state auditor, I see as well. Thanks for joining us. I especially want to start by thanking the employees at the hospital for the chronically ill here. It certainly should be obvious to all of us. It certainly is obvious to me about how critical all of you were and continue to be over the last 19 months under the conditions of COVID-19. We know clearly that the populations that are most at risk are the population that you work with every single day. I know it's been difficult. We are in constant communication with the hospital system across our state, with other healthcare facilities like this one, and we're just mindful of the stress that you've been under, the difficult conditions, fear, all the rest of it. So just a heartfelt thanks to all of you. Thank you for providing that frontline medical services and meeting the daily needs of the 89 residents who live here and who are at risk. I'm told, glad to hear that 94% of the residents are fully vaccinated against COVID-19. That's really incredible. You probably know we're doing pretty well with the general population. We met the the president's objective of having 70% of adult Delawareans vaccinated by July 4th, and we met that, and our senior population, those my age and older, are overwhelmingly vaccinated. Not so much for young adult populations 18 to 35, which are just now passing the 50% mark. And of course, our little ones are not yet eligible. Our teenagers are doing pretty well. That's a real statement for their parents. But with those gaps, particularly large gaps in part of the population, we know that creates vulnerability for COVID spread, and we've been seeing this. But 94% of residents, 83% of staff. That's really incredible. And so thank you for that. Thank you for your service. Thank you for getting vaccinated to protect yourselves, your families, your seniors, the people that you serve every day. We've been making announcements this week as to how we're going to spend resources made available by our congressional delegation, by the Congress and President Biden. They're not able to be with us. They're at work today, but I want to thank them in their absence. And in particular, I want to thank Claire DeMattias, who's here. I'm going to ask her to stand for her tremendous work. This is not just what Claire does most, I think, is outreach. She talks to just about everybody in our state, all the healthcare providers, all the business groups, you name it, all the legislators, to determine the best use of these funds that we've received from the federal government. And the purpose of the funds is to protect vulnerable populations, to address some of the challenges that vulnerable populations have in our state, to enhance our public health and social services systems, address some of the challenges that predate the pandemic, but will enable us to continue to respond to this pandemic and the future challenges that we face in the future. So this week we've announced, prior to this week, we announced a $100 million investment to add on to investments that we've already made with Sussex County in broadband access in the lower part of our state, in Kent County and Sussex County in particular. This week we we announced an investment of $26 million for a low-income housing project, really a great idea that's been, frankly, worked on for many years now, and this investment of $26 million will accelerate by about 5 or 6 years the completion of the housing units there and the supports that are being made available in healthcare and education and the rest for the residents of that. We also announced a significant commitment to workforce. One of the biggest challenges that we face now, and you face it too, is to attract the employees that we need, the nurses, the care professionals, you name it, construction, skilled trades, IT professionals, and so we've announced millions of dollars for training programs. We have more job openings than we do people looking for work. That's a good thing from one perspective, from the perspective of those looking for work. It also creates some wage inflation, and we're seeing that with state employment as well, and we'll have to address that. We're competing, as all of you know, with private sector hospital systems and the like. One hospital system I know is offering $10,000 bonuses. That's pretty tough to compete with, but we're going to do our best. One way to do that is, one of our biggest commitments is right here on the campus of the Hospital for the Chronically Ill, to replace the aging building with a new one with an investment of $50 million right here. A new hospital will generate 250. Yeah, that's something to cheer about. Obviously, it provides better working space for all of you, better space and more protective space for your patients, some of the most vulnerable, and at the same time create 250 to 300 construction jobs, which again is a priority of ours and of the ARPA funding. I'm told that the buildings here date back to the 1930s and 1950s. That's a long time. Prior to my birth year of 1956, there are floors in the buildings that need a lot of work, that aren't usable, and apparently the existence boilers and systems are obsolete and inefficient. Today, while the residents get five-star treatment from all of you, and for the dedicated staff, they do not live in a five-star building, and they ought to, and that's what we're attempting to address. We can do better, and we will. I want to thank all of you for the work you're doing. I want to thank Senator Enders and I was going to say Congressman Carson. You don't want to be a congressman, I can tell you that. And Representative Carson for their support on their commitment to these facilities. I can tell you it's there, and it's been there for a long time. The staff that are their constituents here in the greater Smyrna area, their commitment to building a new nursing facility and other investments here in the greater Smyrna area. I do want to mention before I close and hand it over to Secretary McGarrick a couple other things that are related, health and social service related spending. We have already committed $10 million in ARPA funding, funds I believe that go right to the Department for COVID-19 testing across our state. We should give a hand to all the partners that we have in our testing operations, vaccination operations across our state. Our Lieutenant Governor has been out there with the homeless trying to get people vaccinated. This testing program is really critical to our success. In addition, on the social services side, we've already received over $10 million in funding for the LIHEAP program. Those of you who know what LIHEAP is, it's low-income heating assistance. It's really come at a better time. So I want to thank, again, close my remarks by thanking all the folks that work in this facility and have for a lot of time. You know you're doing the Lord's work with that tremendous responsibility. I know it's been more difficult than ever over the last 2 years, and I can't tell you how much I appreciate what you do every day with the kind of compassion that you bring to your job. This investment of $50 million will bring you a five-star facility in which to work to go along with your five-star treatment of these patients. So thank you very much. And with that, it's my privilege and pleasure to introduce the Secretary of the Department, Secretary Molly McGarrick.
Thank you so much, Governor. And thank you all so much for being here. I want to recognize we have pharmacist partners who's saying they've also been on the front lines supporting residents, and we also had vaccine clinics here, so to recognize them as well. Thank you. And it's an honor to be here with the Lieutenant Governor, the Auditor, Senator Ennis, Representative Carson, and all of you, so many DHSS colleagues. It's an honor to be here with you today. And I want to start where the Governor left off, which is thanking the amazing staff members at the Hospital for the Chronically Ill, as well as across the Division of goodness Lord, aging in adults with physical disabilities. So many, I apologize. Thank you. The pandemic has been difficult and challenging, especially apparently on my memory today. But you all have done everything in your power, literally everything, to keep the residents healthy and safe, to protect yourselves, to protect your colleagues, to protect your families. And I apologize for marring such a happy day, but I do want to recognize the 15 residents that unfortunately passed away due to COVID during this time, and would ask for a brief moment of silence in their honor. Thank you. Beyond this simple remembrance, I know that the staff at DHCI takes each and every loss of residents deeply personally, and each of these 15 precious lives has been honored, remembered, and celebrated at their passing, but thought it fitting that we acknowledge them today as well. And so again, I really want to salute the leadership and the staff at Hospital for the Chronically Ill. As the Governor said, you maintained a 5-star rating, which is no small feat, and it's not something that every long-term care facility in the state can boast. But to do that and achieve such excellence during a pandemic is so worthy of recognition and honor, and is just the clearest signal of your unwavering commitment to the residents here at Hospital for the Chronically Ill. And I'm just so excited to see what the team is able to do with a brand new facility. The person-centered care that you already provide, to be able to do that without the barriers of walking through hallways and facility ways, moving people between buildings, is just going to make your life so much better, as well as the residents. And not to mention the environmental changes that this new facility will bring will better support our state's response to the next pandemic, or even a really bad flu season, which we know can be challenging for long-term care residents. And as the Governor said, that's exactly what this funding was intended to do. I want to also acknowledge, and I'm incredibly grateful for David Noonan, our Associate Deputy Secretary. She was the former Division Director of DSAPID, as well as the current Director, Melissa Smith. She was formerly the Deputy Director. Also Brian Bailey, who's the current Deputy Director. And it's a shame that they're not up here today, because it really was these two women who had the foresight to bring stakeholders together in 2019 and write a grant. Melissa Smith wrote the grant for the 2020 feasibility study, upon which basically this $15 million, we were able to turn something over to Claire DeMatteis and say, hey, we have an idea for you. It's all ready to go. So as the famous scientist and vaccine pioneer Louis Pasteur said, fortune favors the prepared mind. And that is, again, certainly true in this situation. It really was the foresight and preparedness of the DSAPID leadership team that enabled us to move quickly into action, with obviously the Governor's support, when this ARPA funding came to the state. And before I close, I need to really offer a special thanks and acknowledgement to Senator Ennis and Representative Carson. They are here each and every day, year after year. Representative Carson was saying his dad worked and had a farm, and they produced some of the masonry and the sand that went into the masonry to build. So their commitment and really deep roots in this community, and their support of the residents and the workers at Hospital for the Chronically Ill, is really unparalleled. And many of you, maybe some of those who weren't here, I want to acknowledge that last spring, really at the start of the pandemic and during a time of deep uncertainty and fear, they organized an appreciation event for the staff. It included fire trucks and balloons and posters and people just saying thank you. And we see you and we see the sacrifices that you are making. And I wouldn't be so bold as to speak on behalf of the staff, but I heard directly from staff members who said that that just was such a boost and really just meant the world to them. So thank you, gentlemen, so much for that. I have no doubt that you both will continue to be the best advocates that DHSS and the Hospital for the Chronically Ill could ever have. And so with that, I think it's fitting to turn the podium over to Senator Ennis to say a few words. Thank you.
First off, I want to say it's a pleasure to be here as State Senator of the 14th District. I just want to mention that I represent the MOT area and the Smyrna-Clayton area in the 14th, which are pretty well established growth areas, as you know. You know, Bay Health and Christiana can attest to the fact that I had always wanted to see satellite hospitals in my district. And I work with them, they will attest to attempt to accomplish that. Well, we have Bay Health here in Smyrna now, a hospital, and we have Christiana Hospital in Middletown, which is also part of the 14th District. And today we're announcing a new hospital here in Smyrna at DHCI, not to speak of all the walk-in medical centers of Christiana and Bay Health that's in the Smyrna, Middletown area as well, all within a 12-mile limit. As a state senator, each of you today, I think this is a very important announcement. I want to commend the Secretary, the Division Director, the management here at the DHCI, staff, and certainly all the employees here. This has been a recurring need to invest at DHCI. In the past administrations, we had talk of closing the laundry and moving the laundry north to Newcastle County, and also even talk of closing DHCI. Obvious to say, Representative Carson and I both strongly opposed it. Not on our watch. As a former state trooper, Delaware National Guardsman, and about a 62-year member of Volunteer Fire Company, I've always been interested in public safety and health and supported first responders and police. Through legislation, I was able to sponsor creating a statewide paramedic program, the first statewide trauma registry in the country, the EMS Improvement Act dealing with basic life support, and the EMS Preparedness Center, which has been very active right here at DHCI in the COVID pandemic. So with 3 hospitals in the 14th District during my tenure, Governor, how's that for legacy?
That's pretty good.
Again, I'm happy we're funding through the bond bill last year the expansion of the new Health and Social Service Lab, also on these grounds. Thank you all very much. Pleasure to be here.
Good afternoon to everyone. It's a pleasure to be here today, and I just have to echo what a fantastic job and a wonderful job that the staff does. Some of the things that you do and see every day is it's just incredible how you can do it day after day, and many thanks to all of you for that. I'd also like to thank the governor and lieutenant governor for their leadership on the pandemic and all that it's brought us and the misery of it. But because of the leadership there, we can now see the light at the end of the tunnel. And thanks to Secretary Molly and all of her staff, good things are happening in that department too. And we thank you for your leadership. It was spoken about some of my family had a little bit to do with this. Well, when this building was first erected, my grandparents owned a farm across the highway, which was a dairy farm, and in the back of it they had a small sand pit, which they they use to bring the sand over here to mix the mortar for the building. So the ties go back a long way to my family. And it's been a major part of the community in Smyrna for the better part of the last century, with a skilled staff at the facility has been providing no service since 1931. Over the past year and a half, we've seen how important it is to invest in our healthcare infrastructure, especially our hospitals, which have done an excellent job taking care of residents during a dire and unprecedented situation. With this investment from the American Rescue Plan, we're making an important investment in our community health system at a very critical time. The 72,000 square foot addition will provide new rooms for residents, an updated HVAC, air purifiers, all of which will help prevent the spread of COVID and other viruses. We don't just owe these needed renovations, which will drastically reduce the spread of infectious disease to the patients. We owe it to the healthcare professionals who have worked tirelessly for the last 20 months and certainly far beyond that. When DHCI opened its doors nearly a century ago, it was a state-of-the-art building. With these improvements and renovation, this hospital will once again be state-of-the-art and positioned to give all residents the best possible care. I want to thank everyone who made this investment in these renovations possible and look forward to seeing the completion of these renovations, and we're all being right here for the dedication. Once again, thank you.
Thank you, Representative. A measure of society is how you treat your vulnerable. I'm thinking of those famous words of Gandhi. And Governor, thank you for your vision and your leadership to take care of our most vulnerable. There are not words to express, as we've heard from everyone today. And as I was driving here, it's kind of happened to me yesterday, Governor, when we were announcing the other ARPA funds in Wilmington. It dawned on me over the past few years, I've been so fortunate through your leadership to facilitate the work of 3 groups that kind of converged today. One is the Pandemic Resurgence Advisory Group. The other was the Complete Count Census Group. And then also, as our secretary channeled earlier, the work of the Behavioral Health Consortium. They converge here. And how they converge, first and foremost, is through this pandemic resurgence. A year ago, a year and 2 weeks exactly, we handed to our governor with our Secretary McGurk, many leaders in the room here, and I know our auditor participated and our leadership in the House and Senate, a plan. But it was CARES Act money at that time that was protecting us, and for the staff and the nurses and the pharmacists and the clinicians and the facility workers, we were scurrying for PPE. We were scurrying for donning gowns. And we didn't have a vision. We didn't know where we were going for the future. And it is incredibly important that our members of Congress, our congressional delegation, our Congresswoman Blunt Rochester, Senator Coons, Senator Carper, and President Biden be acknowledged. Because of them, we have these ARPA funds to make that generational impact. And I know our treasurer isn't here today, but I'm channeling our mayor here from Smyrna. She's been working, leading with you and others, a plan and a roadmap, as has our auditor, working on ARPA funding, looking to the future. Really important. And as our governor acknowledged on the checklist behind the mayor is Claire DeMatteis, who keeps us straight on the lines and where we can spend funds and where we can't. But I want to touch a moment. I brought my special mask today. I have a special mask. This kind of goes out with me sometimes, Governor, when I am with the homeless. It's my nurse mask on the front. And this is to all of my clinicians. How many of you are clinicians here or working at the hospital? Give me a wave. My pharmacist team, I can clearly see. Clinicians, how many of you work in facilities? Keep us safe, keep us clean. Really important, yay. And my mask is twofold. On the front, we have the stethoscope, and we have this, and somebody made this personally. Not that we are, but together, Wonder Woman, Superwoman, all of these on the other side, and in the center is a purple heart. And that represents the behavioral mental health component that goes along with these challenges that you've faced. I can feel in my heart the 15 members who were lost here. I know as a nurse, I have been present when we're holding the hands of persons leaving this world and welcoming a new babe. the distinct impact that that has. And we cannot thank you and all of those taking care of our long-term care patients across this state today. They will be referred here because of our census, Governor, as you indicated, our aging population. And you're right, dogged members to protect us, to make sure we have long-term bids have been Senator Ennis and Representative Carson. They have been dogged, making sure that we have the facilities and the structure. And if you think about it from the census perspective, this year, a third major growth was in over 65, in particular in Sussex County. And as we look at that population trajectory, it's kind of scary, Governor. You and I are going to move into this next category. Well, the next one is, according to our Resource Advisory Board, by 2040, our greatest significant impact will be over 85 with a 171% increase. I want you to think about that. This is future. This is forward thinking, not only to pay respect to our COVID pandemic and the work we've had to do now, but this will be state of the art and moving us forward into the next 20, 30 years. Really important data from the census. And part of that census, so we have the pandemic resurgence, the hard work that you each and every one have done. We've got the census telling us we've got to be prepared here in Delaware. We had to close and shutter the doors of facilities that were not up to standard. Important. The Purple Heart that I look at often and think about is our behavioral health work. And we know, if you read this month's journal, which probably not many of you do, just a few of us in public health, this month's Journal of Public Health, it's about dementia. And I know thankful to our leaders here at DSAP and now higher in the department, to the team of nurses, you've known for a long time about dementia. The American Geriatric Society tells us that around 47% of all of our long-term care clients have some form of brain health compromise. So the work we are doing, the new hospital facility that we're putting in place, will be hopefully a unit that will help us devise and develop as we address issues of dementia and issues of behavioral health also in the long term. So, Governor, I was really pleased driving here today to join our frontline incredible workers, those protecting us at the facilities. And I'm sorry that our members of Congress can't be here. I know they're busy and our senators are busy. But it is really life-changing and it is really exciting. And I'm proud to do it with my former House and Senate colleagues here in Smyrna. It's central to the state. It's a great location. And we're going to work really hard, according to your leadership, Governor, this past week and yesterday, shoulder to the metal, foot to the pedal, to get the workforce. Because as a professor of nursing, our governor indicated, it's tough. It's tough right now. You all are so incredibly valued. We just cannot thank you enough. You do, as our governor started, the Lord's work. So I'm going to stop with that and just say thank you for taking care of our most vulnerable. This is an exciting day, and I cannot wait to come back for a ribbon cutting, Governor. He knows as Lieutenant Governor, I get to do a few of those. This is one I don't want to miss. So thank you all for this day. Thank you, Governor Carney, for your leadership, and we'll let you wrap us up.
Thank you, Madam Lieutenant Governor. I need to kind of underscore a couple points. It was mentioned that over the years there's been plans to repurpose these facilities, move them, close them, and I can tell you that it was through the hard lobbying of Senator Ennis and Representative Carson and others, Senator Jim Vaughn before him, that we are able to make this decision to reinvest in this facility because the facility still remains here after so many years. And the other point that was made is that we have this opportunity again. The federal funds that are coming in have to be spent quickly. They have to be spent in a way that generates an immediate economic activity, the creation of jobs, and et cetera, the improvement of healthcare facilities. And due to the leadership of the folks that are here, prior director and deputy directors, you have a plan that was ready to go on the shelf. We were able to take that and make the decision to make this incredible investment. All the other things that we've announced this week, same kind of thing. There are projects in process. They were well thought out. They were supported by the communities in which they're located. They were building, our investment was building on existing investments by the state and local government. So again, just to wrap it up by thanking all of you for the tremendous work that you do here. You're going straight to heaven. No purgatory for any of you guys. God bless you. I'm told there's a facility tour of some sort. I had a little tour of the ground where the new facility is going to be, so I look forward to seeing a little bit more if my time permits.